Good morning. Welcome and thank you for attending. Today I'm joined by Dr. Carol Zimbalatti, public health physician, who will provide an update on our local COVID-19 situation, and Andrea McLellan, director of COVID-19 immunization strategy, who will provide an update on the vaccine rollout. Before we proceed, I'd like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. Through continuous education, we can work on reconciliation. As of Friday at 12:01 a.m., we'll be moving into step 3 of Ontario's roadmap to reopen. As new opportunities become available to socialize and spend time with larger amounts of people, it is important that everyone does a risk assessment before attending a gathering or public space. While provincial and local cases continue to decrease, the Delta variant remains a concern. When going out, you need to assess the risk to yourself and those in your household. Think about where you're going, who you're going to be with, and really consider the health and risk to those who are unable to be vaccinated or are not yet fully vaccinated. It's a very exciting time as we slowly move back to normalcy, but we can only do this if we continue to make informed decisions and evaluate our personal risks. We do ask that you continue to follow public health measures, such as washing your hands often, wearing a face covering when required, physical distancing, and being fully vaccinated. This week, the World Health Organization made a statement on mixing and matching vaccines, which was taken out of context and caused a lot of confusion. They clarified their statement on Tuesday. The World Health Organization was referring to not having the public decide on mixing and matching booster shots, but to follow public health advice if booster doses are necessary. The WHO statement was not referring to Canada's current vaccine rollout. The decision to allow interchangeable mRNA vaccine second doses was approved by Health Canada and the National Advisory Committee on Immunization. The decision to mix and match mRNA vaccines was based on studies from the UK, Spain, and Germany that have found mixing the vaccines to be safe, effective, and provides a strong immune response. The health and safety of those in our district remains my top priority. Waiting to receive the same second mRNA vaccine dose as your first puts you at an increased risk of getting and spreading COVID-19 or a variant. The safer option is to get the first mRNA vaccine available to you for your second dose. The province will continue to monitor the data, working with Health Canada, NACI, and the federal government. I continue to encourage everyone 18 and older to get the first vaccine available to them. With that, I will pass it over to Dr. Zimbalatti.
Thank you, Dr. Chirico. In the last 7 days, we had 10 new cases, bringing our total case count to 623, with 443 in the Nipissing district and 180 in the district of Parry Sound. The health unit currently has 6 active cases. Of our active cases, 6 have tested positive for a variant of concern. 5 are the Alpha variant, and 1 case is the Delta variant. Furthermore, a total of 10 cases in our region, including 7 in the Nipissing district and 3 in the Parry Sound district, have tested positive for the Delta variant, though only 1 of those cases is currently active. Some new cases are still awaiting further variant testing. Currently, no individuals are in hospital due to COVID-19. On Monday, we declared the outbreak at the North Bay Jail over. We continue to monitor the local COVID-19 situation and provide updates Monday through Friday on our online status board. With that, I will pass it back to Dr. Chirico.
Thanks, Dr. Zimbalatti. And now we'll have a COVID-19 immunization update by Ms. McLellan.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we are now at 76% of adults 18 years of age and older who have received at least 1 dose of a COVID-19 vaccine, and 59% of adults 18 years of age and older who are fully vaccinated. As a comparison, As of yesterday, the province is reporting rates of 79.5% for first doses and 58.4% for second doses. And as of 6 days ago, Canada was reporting rates of 69.7% for first doses and 43.4% for second doses. Additionally, 58% of youth 12 to 17 years of age have received at least one dose of COVID vaccine, and 23% have received both doses. As of yesterday at 3 p.m., a total of 150,862 vaccinations have been provided in our district. This week, we announced that all COVID-19 vaccination clinics on or after August the 3rd would have been cancelled. These appointments were tentative appointments booked into the system at the original 16-week interval between doses. With the shortened interval for second doses, the health unit is encouraging everyone to book their appointment at the shortened interval. Individuals who provided an email or mobile phone number should have received a confirmation of the cancellation. Individuals who have had their second appointment cancelled can book into any of our open clinics or attend a clinic accepting walk-ins. Appointments on or before August 2nd have not been affected. This week, the health unit also launched our first walk-in opportunity for clinics. These walk-ins help to address the open appointments at the clinics this week, and we will continue to offer same-day walk-ins when vaccine is available. Information regarding clinics that are accepting walk-ins will be shared through a public service announcement that will be posted on social media and on our website. Today, we will be accepting walk-ins at the Memorial Gardens Clinic in North Bay between 1 p.m. and 7 p.m. with 450 doses of Pfizer vaccine available. And I'll turn it back to Dr. Chirico.
Thanks, Mr. McLellan. So that concludes our prepared remarks, and we'll start taking questions. Please associate your name with your question if you can, and we'll try to answer as many as possible. And if we don't have an answer for you, we'll try to get back to you for sure with an answer. So I'll turn it over to Alex.
Thank you. Our first question is for you, Dr. Chirico. It comes from Jennifer from the Nugget. Do you support a vaccine passport that would allow those who are completely vaccinated more freedoms than those who aren't vaccinated or who are not fully vaccinated?
Well, thanks for that question, Jennifer. It's an excellent question because it raises a lot of controversy. And it really depends on what freedoms you're talking about. And there's certainly equity issues, people that may not be able to, that might not have access to their vaccine, or they couldn't get a vaccine for whatever reason. I think for international travel, that it makes a lot of sense. And it really depends on what freedoms you are talking about, referring to sort of on a day-to-day basis. And that's where I see potential problem. So I don't think that it has been fully worked out as far as all the details go. So I would be in favor of an international vaccination for travel, but I'm not so sure that it would be easy to practically implement on a day-to-day basis and enforce.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Clark from your TV Cogeco News. Good morning. When making decisions as to who to socialize with by factoring in risk, is there consideration being taken for the potential widening of social divide between vaccinated and non-vaccinated individuals?
Yeah, I think that you need to really try to assess what your own personal risks are and those of the people you're going to be with. So if you have that information that if people offer the information that they are fully vaccinated and you're fully vaccinated, and that means not just fully vaccinated but protected. And to be protected, you need to wait at least 14 days after you've had your vaccination. So it depends on how vulnerable you are. It depends on where you're going to be, the environment. Is it in a closed space with poor ventilation, with a lot of people? That may be something you want to avoid because you don't know the immunization strategy. And that's different from if you have, family and friends that are fully vaccinated, that have been taking precautions, then again, you have to assess what's going on in our communities locally. What are the cases doing? Are we seeing increasing hospitalizations and our deaths? Right now, we're not, which is really great, and we're moving in the right direction. So there's lots of positive aspects to it, but we can't certainly give advice on every single scenario. People are going to have to decide for themselves and take appropriate caution with how they are going to behave and whether they need a mask or physical distancing. The government's going to be coming out, Ontario, with an update with regards to what Public Health Agency of Canada has come up with regards to, if you're fully vaccinated, what you can and cannot do. So we expect that to be happening soon. Thank
you. Our next question is for Andrea. It comes from Rich Kaufman at mynorthbaynow.com. How successful was the first walk-in vaccination session? Do you expect that most vaccine clinics will now offer walk-in availability?
Thanks for that question, Rich. It's a good question. Our first vaccine walk-in attempt was successful. We immunized just over 150 people who presented to the clinic for immunization. As I indicated in my opening remarks, we have 450 doses available at today's clinic in North Bay for walk-ins if people are interested in attending the clinic. Are we planning to continue them? We're looking at that as an option. Certainly not everyone is in a position to be able to make an appointment, and provided we have vaccine available to do that, we will be doing that. So we will be looking at our overall clinic strategy and looking at whether including a time frame for walk-ins makes sense to include as well. But certainly right now, as clinics are not filling, we will be assessing the ability to add walk-in individuals to those clinics.
Thank you. Our next question is also for Andrea. It comes from Jennifer from the Nugget. Any specific strategies the health unit is going to do to reach those still not vaccinated?
Hi, great question, Jennifer. What we're currently doing is working with our planning and evaluation team to identify where there may be pockets of lower immunization rates within our district. And then we'll be working with municipalities to identify appropriate strategies such as pop-up clinics, mobile clinics, to address providing access for those individuals. We also continue to work with our community partners in the various areas of the district to identify individuals who may not be comfortable with accessing vaccine or be unable to attend a mass immunization clinic. And we'll be looking at strategies to assist them in getting access to the vaccine as well. And that'll include involving more primary care practitioners and community partners in having the ability to provide vaccines as well.
Thank you. Our next question is also for Andrea. It comes from Jennifer from the Nugget. Are you disappointed with our vaccine rates? Is there an age group that you're targeting?
Great question, Jennifer. No, I'm not disappointed with and I don't think that the health unit as a whole is disappointed with our rates. We're happy that we are continuing to see people showing up to our clinics and continuing to immunize. We're definitely seeing a lower immunization rate in individuals 18 to about 40. And so we are trying to increase messaging out to those groups and encourage them to get their immunization. And I mean that those age groups also are the age groups that are generally working, so have less flexible schedules as far as being able to access mass immunization clinics that are held during the days, which is why we try to provide some clinics that run after hours, and hoping the walk-in ability will also help with that.
I'd also like to add too that when you're looking at immunization rates, they tend to plateau at a certain time frame, and you're never going to get 100% of the population immunized. So it does plateau, and when you consider that it is a new vaccine, to get rates as high as we have them and to be as comparable as we are to the rest of Canada and to Ontario, I'm extremely pleased with the number of vaccinations, and we're going to continue to certainly to get as many as possible that want the vaccine to be vaccinated. I think it's going to be the best way that we have to protect ourselves against serious disease and hospitalizations. And that's going to be our new normalcy, I believe, where I think that COVID-19 is going to be endemic, meaning that it's going to be with us for some time. We will see different variants for sure, but the best protection that we can have and to get back to a more normal lifestyle is to similar view that we have with the flu, in that we live with it every year. However, we prevent serious illness and hospitalizations and deaths with people being vaccinated and taking public health measures as well. So with all of that, we're going to try and get as many people vaccinated as we possibly can.
Thank you. Our next question is for Andrea. It comes from Eric Tashner at CTV News. Has the WHO statement deterred people away from getting the vaccine out of fear?
I would suggest that in our district, we're not seeing that. We've had questions at the clinics about that, and we've been able to provide the information to individuals to help them make an informed decision. And I don't believe that that statement in particular has had an overall negative impact on our numbers.
Thank you. Our next question is also for Andrea. It comes from Eric Thompson. The first dose vaccine rates continue to float around 75%, with notably less uptake in the under 40 population. With the province already headed to stage 3 of the reopening, do you think the one step closer is still an effective message for encouraging those younger people who are hesitant to get the vaccine?
Great question, Eric. Thank you. Yes, I do think we're starting to see a plateau with first doses at the 75% mark, and we expected that to happen. We will continue to promote the message of one step closer, encourage people to follow the public health measures, and promote vaccine as one of the ways to ensure that we can get back to one step closer to being normal, our normal lives again, or our new normal lives. So I think it's still a very valid campaign, and we will continue to promote that.
Thank you. Our next question is for Dr. Chirico. It comes from Jennifer from The Nugget. When it comes to mask wearing, is there any discussions about loosening up those restrictions?
Yeah, it's a great question. It's on the mind of a lot of people. Yes, that is certainly under discussion, and but it also depends on the context that you're talking about. If it's related to sort of healthcare workers or retirement homes or vulnerable groups, then that's a little bit different than the general population. But yes, and I think that certainly that needs to be looked at, especially with more and more people being vaccinated, depending on the setting you're in. You may, and I know certainly other countries and other public health agencies have said under certain circumstances you don't need to wear a mask. And so you will hear more about that probably within the next little while for sure.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Rich Kaufman at mynorthbaynow.com. Do we have an update on the cases that are non-vaccinated and those that were fully or partially vaccinated?
So the last information I have was from approximately or just over a week ago. And since January 1st, approximately 90% of our cases were in those who were unvaccinated. More recently, since about the middle of June, I believe it was about 88% of our cases were unvaccinated. I don't have the particular numbers of partial vaccinations, but I believe in total we've had 2 cases in fully fully vaccinated individuals since January 1st. So definitely we are seeing locally that vaccination, especially with 2 doses, is very effective in protecting individuals from COVID-19 and most particularly from severe disease.
Thank you. Our next question is for Andrea. It comes from Sarah Businet from the North Star. Is it possible to break out the percentage of vaccinated adults and youth by district? If so, what are those numbers?
Thanks for that question, Sarah. That would be a question I will take to our planning and evaluation team who do the data collection and breakdowns to determine whether or not that is something that they can do, and we'll get back to you with a response on that.
Our next question is for Dr. Chirico. It comes from Stu from Bay Today. Do you foresee COVID-19 vaccinations becoming mandatory for students as other immunizations are under threat of suspension?
That's an excellent question. I know it's on the minds of a lot of people. There has been discussion about that. My feeling is that I hope that doesn't happen. I hope that we can get as many people vaccinated as possible. We feel that, you know, in-person learning is really, really important. Mental, physical, and social aspects, and we've seen how it has been very difficult on students not being in school in person learning. So I'd hate to see another barrier, and also remind people that, you know, we've done a great job with our school boards. They've been exceptional in putting in precautions and putting in what needs to happen within the schools to protect the students. We haven't had a school outbreak since the beginning of the pandemic, and we've always, you know, really advocated for keeping them open. And certainly, if there is a problem, we would react quickly to that. So I hope that we don't see it become mandatory. Those decisions would certainly be more on a provincial level, and we can't really predict what the Ministry of Education will be do.
I'd just like to add to that, just to say that, of course, we do encourage as youth 12 and over to get vaccinated before the start of school, because it will make it safer for everyone, as well as encouraging teachers to do the same. But I think rather than, especially for this September, that students who are not vaccinated be subject to restrictions, I think the overall vaccination rate may have more of an impact in terms of what sort of measures are necessary in the schools. And if the more children, more students we get vaccinated, the more those students will be able to experience a normal classroom environment.
Yeah, that's a really good point, Carol. Thank you for that. And the other thing I think that we always go back to is that the safest way to protect students and to prevent outbreaks within schools is to really have low community transmission. And the best way to do that is to really follow the public health guidelines, as well as everybody getting vaccinated. So we all play a part in protecting our kids and their students.
Thank you. Our next question is for Andrea. It comes from Sarah Businet from the North Star. Is the health unit on track to vaccinate youth ahead of the start of the 2021-2022 school year?
Great question, Sarah. Thanks for that. We are working on continue to plan with our school boards to provide immunizations for youth. All youth can book into any of our mass immunization clinics. We're working to provide second dose mass immunization clinics specifically for youth. We are working with community partners who may have youth in their services who require specialized formats for receiving vaccine. And so we are continuing to try to drive that number up as far as our immunization rates, and we'll continue those efforts. I think we are on track to immunize those who choose to be immunized before the beginning of the school year.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Sarah Bissonette from the North Star. What does the dominance of the Alpha variant here tell us? News reports seem to show that the Delta is the dominant strain elsewhere.
Yeah, I don't think I can provide a complete explanation for that. We have seen some Delta cases here. However, just in terms of what is circulated, it is the Alpha variant that is still the dominant variant here. And some of that is just by chance, I believe.
I'd also add too that it's certainly an opportunity. We do know that the dominant strain is the Delta within Ontario, and that it is highly transmissible, much more so than Alpha, and very likely we will be seeing cases of the Delta come into the district, and I think that it gives us the opportunity for people to get vaccinated because it's. We know that it's likely will come at some point, and the real issue is that we want to prevent people from becoming really, really sick and ending up in hospital and overwhelming the healthcare system and or dying. You know, those are the things that we're really trying to prevent. So great opportunity now when things are have slowed down as far as the cases. Get vaccinated, get protected. We have some time to do that. It is an opportunity.
Thank you. Our next question is for Andrea. It comes from Stu from Bay Today. How much longer will clinics be held at Memorial Gardens? Where will they be located next?
Great question. We are in the process of planning our transition away from mass immunization clinics over the next little while. We're certainly starting to see a decline in the number of people booking into our large scale clinics. And so we will probably start to scale those down a little bit in that location. And as we start to scale back on the size of the mass immunization clinics, the need for a location as big as Memorial Gardens decreases. So we will be looking at what our options are going to be, whether we are going to move to a smaller location, whether we'll be focusing more on pop-up clinics and mobile clinics, whether we'll be, how we involve increased pharmacy and primary care involvement in immunization and all of those strategies. So more to come, but we're definitely starting to plan that transition away from large scale mass immunization clinics.
Thank you. Now, our next question is for Dr. Zimbalatti. It comes from Eric Thompson. In talking to unvaccinated individuals, one of the common factors cited about why they are nervous that the vaccination is that the vaccination seemed to come out too quickly, and they're worried that the vaccine was rushed. I didn't see an answer on the COVID vaccine QA page, so I'm wondering how you would respond to those concerns.
Yeah, so certainly it was very important on a global scale for us to have access to COVID-19 vaccines. So a lot of resources were poured into developing these vaccines quickly, which means that there was the same amount of work that went into it, but it was just done in a more concentrated fashion because we had so many more resources thrown at this. And likewise, in terms of the approval processes, it was very important that all of the necessary steps and necessary due process took place to approve vaccines, but recognizing the need to have COVID-19 vaccines available quickly, more resources were poured into the approval process so that it could occur more quickly with all of the checks and balances still in place.
Yeah, I'd also like to add to that normally in the approval process for vaccinations, for vaccines, it happens sequentially. So you go through the first stage, you wait till the second stage, wait till the third stage. And what they were able to do was to do a lot of it concurrently, get it done. But the safety and the quality of the vaccines and any adverse effects were all monitored throughout. And so none of that was compromised. And when you look at millions and millions of people have been vaccinated, and yes, there have been some rare instances of problems, but that's what the system is designed to pick up. And you do expect that they're going to be, but there is absolutely no question in my mind that the benefits of these vaccines far outweigh any of the rare and serious, and no question, rare and serious consequences from the vaccines. We have serious consequences from all medication. It's a risk. All medications carry risks with them. And I think the safety profile of these vaccines have been proven that, again, the benefits far outweigh the risks.
And maybe I'll just add to one more thought that, technology is advancing, science is advancing. So, 20 years ago, we didn't have mRNA technology or the knowledge to be able to develop the vaccines in this manner, which has allowed, a more streamlined and efficient way of developing a vaccine. And this is proving that we may actually be able to use the mRNA technology for other applications as well. So I think just the advance of science as well has allowed the speedier process of developing this vaccine.
Thank you. So our next question is for Andrea. It comes from Jennifer from the Nugget. Is there any discussions about booster shots in the fall for the variants of concern?
At this point in time, there has not been any final decisions made on booster shots in general and whether they will be required. That research and conversation continues to go on an ongoing basis. At this point in time, I'm not aware of any plans for a booster dose in the fall.
And I'd also like to add too that certainly it will not be left up to the vaccine manufacturers to determine whether or not a vaccine dose is required. Obvious bias, but not to say that they would be biased, but there will be independent reviews to determine whether or not a booster dose would be required.
Thank you. And just following up with that question from Sarah Basenet from the North Star to Andrea. Is there work being done to add the COVID-19 vaccine into the local annual flu shot?
I'm not aware of that. I don't have any information on that.
Thank you.
I think we would need further information on whether booster doses were required before there would be any thought of moving in that direction to include it within the flu shots. And so I think we're quite a few steps away from that.
The next question is for Dr. Zimbalatti. It comes from Eric Thompson. Are there any more details or updates around the case in the child care center? Have there been more cases discovered?
So to my knowledge, there has been testing that is taking place to individuals that may have been exposed at the facility. However, I am not aware of any new cases being identified at this point from that testing.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. When it comes to children under the age of 12, parents are wondering when they might get some protection. Any updates for that age group?
I know there is ongoing research right now, Jennifer, on that age group, and we are anticipating at some point this fall there will be a vaccine available. The vaccine will be available for 5 to 11-year-olds. Don't have a tentative date on that as of yet, just I know the work is underway.
Thank you. Our next question is for Andrea. It comes from Mo from My Parry Sound Now. There's a concern province-wide that first dose vaccines are plateauing and that data from individual health units show that as well. Do you think our region is plateauing? How do you reach that remaining 10 to 15%?
Great question, Mo. I think I do believe that we're starting to plateau with our first doses for sure. And I think that's why we need to start looking at alternative strategies for reaching out to people. Part of it could be that they're not comfortable coming to a mass immunization clinic. Part of it may be education requirements with respect to understanding the importance and the safety of the vaccine. And part of it is people who just aren't able to maybe get to clinics. And so that's why we're looking at the data to determine if there are pockets of communities that may have lower immunization rates within our district, and then looking to identify what the cause of those lower rates are and how we can work to increase the rates for those areas.
Thank you. Our next question is also for Andrea. It comes from Clark from your TV Cogeco News. Has the One Step Closer campaign been a success?
I think the goal of that campaign was to have people start thinking about what they can do to get one step closer to normal, or our normal state. And I think that for that it has been successful, because we have worked to try and get people to think what they can do to make things move in the right direction. And so trying to personalize it and saying you're part of this and you're part of the solution. So what can you do to take it one step closer to getting back to a normal life in our district? And so from my perspective, yes, I think it has been a very successful campaign, because people have thought about themselves and how they factor into all of this.
Thank you. Our next question is for Dr. Chirico. It comes from Rich Coffin from mynorthbaynow.com. Can you reiterate the messaging around consider the risk with the stage 3 reopening tomorrow?
Yes, certainly. Thank you for that. Really, it's going to open up to more opportunities for social gatherings for sure, and other activities and events. And it really comes down to assessing your own personal risk. You know, your age, your health conditions. You know, are you immunocompromised? Do you take medication that could certainly affect your immune system response? Are you fully vaccinated, or have you reached the point 14 days after your second dose that you are protected? Those are things that you need to consider from a personal perspective, as well as those within your household. And then you have to look at, so where are you going to be going, and who's going to be there? Is it going to be a large crowd? Do you really want to be, if you are vulnerable, in a large crowd with people that you don't know if they are immunized or not? And that's a different scenario than if you are certainly going to family and friends that you know are fully immunized and taking precautions and are protected. So those are the things that we were talking about as far as a risk assessment.
Thank you. So that concludes all the questions for today's press conference. The recording will be up on our website this afternoon, and we'll see you next week at 10 a.m. Thank you.
Thank you.